Hello and welcome to What the Health, the everyday person's guide to the Patient Protection and Affordable Care Act, also known as healthcare reform, and a few other slightly biased terms. Each week, we're going to go page by page through the PPACA, translating the terms and decoding the language so that anybody can understand what it means in plain, nonpartisan English. Now, the PPACA, which is what we're going to call it here to save time, tells a story. It's up to you to decide if it's a good story or a bad story. We're just here to provide the information. We're kind of like the binding on one of those choose your own adventure books. We hold it all together, but it's up to you to decide what happens to the main character. Those are really good books. I wonder whatever happened to those. Anyway, back to the point. The PPACA does tell a story, and it's an important one for every American to hear. Because whether you like it or not, this law is going to affect you. So let's begin where every good story begins, on the first page. This is the first page of the PPACA, the first of 906 pages of legalese that determine the future of healthcare in the United States of America. Trust me, the story is going to get better. The first page tells us a lot of information, just like the title page of a book. For example, Public Law 111-148 tells us that this was the 148th law signed by the 111th U.S. Congress. It passed on March 23, 2010 under the formal name An Act entitled the Patient Protection and Affordable Care Act. However, Section 1, subsection A, gives us congressional approval to shorten that to just Patient Protection and Affordable Care Act. We've taken a few other liberties here and shortened that to just PPACA, because it saves time. Now, Section 1, subsection B starts the table of contents. Taking up a whopping 11 and a half pages, the table of contents outlines what's inside each of the PPACA's 10 titles, 60 subtitles, and 342 sections. That's not even counting all the subsections, parts, and subparts contained in the law. If you want to read all 11 and a half pages, there's a link to the full text of the law on our blog, which you can find by going to saywhatthehealth.com or by clicking the link in the video information below. For those of you who don't want to read the legalese, don't worry. We're going to do a quick synopsis of what each of the titles means right now. Title 1 is called Quality Affordable Healthcare for All Americans. It covers immediate improvements to healthcare coverage, including establishing minimum standards of health insurance coverage, cost, and access. This means that health insurance companies now have to cover things such as preventative health services and cannot deny you coverage because of a pre-existing condition. They also have to be competitive with state-run plans such as Medicaid and CHIP. For those of you who are not familiar with CHIP, it stands for Children's Health Insurance Plan, and you can think of it as kind of a Medicaid for kids. Title 2 is called Role of Public Programs, and it deals with changes to Medicaid and CHIP. These are federal programs that provide health insurance for low-income people. Title 2 deals with everything from enrollment to usage to the payouts that doctors and hospitals will see from state and federal sources. Title 3 is called Improving the Quality and Efficiency of Healthcare. It's one of the most controversial titles in the law because it deals with doctors and how much they're going to get paid for their services. Since the U.S. government wrote the law, pay-for-performance models have been proposed. What that means is that the amount of money a doctor gets reimbursed by the state and federal sources is directly linked to how well their patients do. If their patient does well, they're going to get more money. But if their patient does poorly, gets another infection, has to go back into the hospital, or even dies, the doctors are going to see little to no money. There's also parts in here that talk about improving patient care and even establish rewards for innovations in medicine. But mostly, Title 3 is all about the money. Title 4 is called the Prevention of Chronic Disease and Improving Public Health. As a student of public health, this is one of my favorite titles. As its name implies, it tries to answer the question of how do we keep more people healthier over a longer period of time. It adds to the reach of public health organizations from the CDC all the way down to your local health department. Vaccines, mammograms, flu shots, even the McDonald's calorie charts that they hand out now are all discussed in this title. And at just 5 subsections, this is also one of the shortest titles. which figures. Title V is called Healthcare Workforce. This is another controversial title because it deals with telling doctors and nurses how to do their jobs. Now, there is always, and I mean always, a shortage of healthcare workers. Doctors, nurses, technicians, even orderlies are always in demand. Part of the reason for this is because working in healthcare kind of sucks sometimes. You're always surrounded by sick people, and sometimes they're kids. Sometimes they die, and all you can do is sit there and hold their hand. It's a very easy field to get burned out in, but it can also be incredibly rewarding. How you cope with it has a lot to do with how you're trained, which is the second part of the problem. Healthcare training costs money, like a lot of money. Trust me, I have a health degree, and the loans to prove it. Title V outlines ways to deal with these costs with the goal of increasing the workforce without increasing their level of personal debt. Title VI is called Transparency and Program Integrity. I'll give you a minute to deal with the U.S. Congress calling for greater transparency. Okay, you're not going to reconcile it in your head. It's going to be pretty funny. The intended goal is to reduce Medicare and other governmental program fraud by forcing doctors and hospitals and even nursing homes to be more transparent in their spending and how they use their reimbursements. This title also contains the Elder Justice Act and the sense of the Senate regarding medical malpractice. These are fascinating bits of sidebar legislation that are definitely worth learning about. Title VII is called Improving Access to Innovative Medical Therapies. The second shortest title, this one is targeted at pharmaceutical companies, specifically their prices and access to their products. Interesting fact for you, the US has the highest prescription drug prices in the world and also the most stringent patent laws regarding those. When the FDA approves a new drug, it can be up to 10 years before a generic drug is allowed to hit the shelves. Since generic drugs tend to be cheaper than the brand names, those 10 years can be a long wait for a patient's wallet. Title VIII is the shortest title with 0 subsections. It's called Class Act. And no, that doesn't imply that it's the classiest one of the bunch. Rather, it's a reaction to a lawsuit that establishes a national voluntary insurance program for purchasing community-assisted living services and support. This would have originally been a mandate, but now it's optional. Title IX is called Revenue Provisions, and good Lord, it's a lot of finance stuff. This covers all the new tax laws, both personal and commercial, and it uses the phrase cafeteria plans far more than I'm comfortable with. I mean, tax law is torturous enough without evoking painful memories of high school lunch periods spent in the library. Anyway, Title X is the final title, and it's called Strengthening Quality, Affordable Healthcare for All Americans. This is where you'll find the amendments and clarifications for all the other titles. You'll also find one of the very few subsections on Indian healthcare improvement. Tucked way down at the end of this title, you'll find the new excise tax on indoor tanning salons and an expansion of the Adoption Credit and Assistance Program. These two aren't actually related. Oh, and there's also a bit in there about student loan repayment help for certain health professionals. So any of you out there with $60,000 in student loans like me, keep an eye out for that discussion. Okay, that's all 10 titles. Don't worry if you don't understand some of it, or all of it. We're going to go over it again. Just not today. If you missed something, you can rewatch the video. Or if you're sick of listening to me, you can go read it on the blog. It's www.saywhatthehealth.com. The link is also in the video information. There's a place on the blog where you can subscribe and get an alert every time a new post goes up. You can also subscribe to the channel here on YouTube. I think the button's above me. So that's it. You've survived the introduction to the Patient Protection and Affordable Care Act. Next week, we're going to dive into Title I, Subtitle A, Immediate Improvements in Healthcare Coverage for All Americans. If you're an American, this one's for you. But you can watch even if you're not an American. We love all of our viewers, even those of you in countries with national health care. See you next week.